What if the very medical checkups you trust to protect your health after 70 are actually putting you at risk? Every year, millions of seniors faithfully go for routine tests, believing they're doing the right thing. Doctors recommend them, clinics promote them, friends encourage them. But hidden deep inside medical research is a truth most seniors are never told. Many common health tests done after age 70 can lead to unnecessary treatments, serious complications, and lifelong side effects. Recent studies show that up to 37% of medical tests in older adults result in overdiagnosis or overtreatment, meaning problems are found that never needed fixing in the first place. Even more shocking, nearly everyone over 70 has no idea they're being overtested. And the number one checkup on today's list? It's been linked to about 5% of all cancer cases in the United States, the same level of risk as drinking alcohol every day. You won't see this warning on a clinic wall. You won't hear it during a rushed appointment. But today, we're uncovering the truth. In this video, you'll learn 5 health checkups you should seriously reconsider after 70, all backed by real studies and real patient outcomes. And trust me, what ranks number 2 surprises almost everyone. Before we continue, pause for a moment and comment below. Where are you watching from? How old are you? Have you ever regretted a medical test or procedure? Do you think seniors are tested too much? We read every comment and often reply with personalized advice. Now, let's begin with the first test, one that looks harmless but can quietly damage your quality of life.
Number 5. Bone density scans. DEXA. A bone density scan sounds reassuring. It's quick, painless, and promises peace of mind about your fracture risk. But after age 70, this test often creates fear instead of clarity. DEXA scans measure bone density and are used to detect osteoporosis. But in older adults, bone loss almost always appears lower because bone loss is a normal part of aging, just like gray hair or wrinkles. Yet many seniors are immediately prescribed medications called bisphosphonates, which are meant to strengthen bones but can cause serious side effects, jawbone damage, severe acid reflux, and unusual fractures. Here's the problem. Large studies show that treating mild bone loss in people over 70 barely reduces fracture risk at all. One major study following over 1,200 seniors found fracture reduction of less than 1% after 5 years, while side effects were far more common. Let me share a real example. A 76-year-old retired piano teacher had never fallen, walked daily, and felt great. A routine scan showed mild bone thinning, not osteoporosis. She was immediately placed on medication. Within months, she developed severe digestive pain and jaw discomfort. She stopped playing piano entirely. When her treatment was changed to vitamin D, resistance exercise, balance training, and diet improvements, her strength returned, and she never suffered a fracture. For seniors who aren't falling or breaking bones, lifestyle changes outperform medication. And according to international research, strength training and balance work can reduce fractures by over 20% without the risks. Don't let a number on a screen scare you into treatment you may not need, because the next test can lead to something even more frightening: brain surgery.
Number 4. Brain MRI for memory changes. Mild forgetfulness can be scary. Misplacing keys, forgetting names, losing focus. Out of fear, doctors often order a brain MRI. But here's the uncomfortable truth. Most MRIs in people over 70 show age-related changes that are completely normal. Small white spots, mild shrinkage, nothing dangerous. Yet once those findings appear, they can trigger panic, repeat testing, and sometimes invasive procedures that don't improve memory and may even make things worse. One large review found that only 3% of MRI findings in seniors with mild memory complaints were actually treatable. That means 97% of patients went through unnecessary fear. Some were sent for spinal taps or biopsies based on vague scan results. A retired engineer in his 70s became convinced he had dementia after an MRI. He stopped driving, withdrew socially, and his anxiety spiraled. When properly tested with simple cognitive exams, his results were completely normal. With better sleep, hydration, and mental activity, his memory stabilized. Unless there are severe symptoms like seizures or rapid decline, a simple cognitive screening test is often a better first step. Before we move on, let me ask you, have you or someone you love ever panicked after a scan that turned out to be normal for age? Share your experience in the comments. Now, let's talk about a test many seniors have had multiple times.
Number 3. Cardiac stress tests. Stress tests are commonly ordered for fatigue, mild chest discomfort, or just to be safe. But after 70, these tests frequently trigger false alarms. In older adults, stress tests can show problems that don't actually exist, leading to angiograms, stents, or bypass surgery that offer no survival benefit. Studies show false positive rates as high as 40% in seniors. One major cardiology review found that more than half of stents placed after stress tests were unnecessary. Patients didn't live longer or feel better, but they did face higher risks of bleeding, kidney injury, and hospital stays. One active senior mentioned mild tiredness on hills. A stress test led to a stent. That night, he suffered kidney damage from contrast dye. His fatigue never improved because his heart wasn't the problem. For many seniors without classic symptoms, simpler tests like resting EKGs or coronary calcium scans are safer options.
Number 2. Colonoscopy. This one surprises many people. Routine colonoscopy is often unnecessary after 70 and rarely recommended after 75 unless there are clear symptoms. The preparation alone can cause dehydration and dizziness. Sedation increases risks to brain and heart function, and the procedure itself can cause bleeding or bowel perforation. Large studies show that for seniors over 75, far more people are harmed than helped. Many polyps found are slow-growing and may never cause problems in an older adult. Non-invasive stool tests done at home often provide safer screening with far fewer risks. Ask your doctor about alternatives because once the colonoscopy cycle begins, it's hard to stop.
Number 1. Full-body CT scans. This is the most overused and dangerous checkup on the list. Full-body CT scans expose your body to high doses of radiation, equivalent to hundreds of chest X-rays. There is no evidence they save lives in healthy people without symptoms, but they often detect harmless findings, leading to more scans, biopsies, surgeries, and fear. Recent studies estimate that up to 5% of cancers may now be linked to medical imaging radiation. One active senior underwent a full-body scan just to be proactive. A tiny harmless nodule triggered months of testing and a biopsy that collapsed part of his lung. Experts are clear. Full-body CT scans should never be used for general screening in healthy adults. Targeted imaging makes sense when symptoms exist. Blanket scanning does not.
Modern medicine is powerful, but more testing does not always mean better health. After 70, less can truly be more. Always ask, what happens if this test finds something? Will it change treatment or just create fear? Real prevention starts with lifestyle, movement, nutrition, sleep, and informed choices. Now, we want to hear from you. Have you or someone you love ever been harmed by an unnecessary test or treatment? What happened? Share your story in the comments below. We read them all. Thanks for watching.